Well, welcome everybody to this, our second in a series sponsored by RBC Global Asset Management, where we're going to dive into impact investing, this time in the context of a now always top of mind subject of public health and how we protect ourselves, our families, and our communities. My name is Megan Thomas. I am the president and CEO of Catalyst of San Diego and Imperial Counties, your host here today. My pronouns are she, her, hers, and I am sitting in San Diego County, which is the traditional and unceded territory of the Kumeyaay Nation, important friends and neighbors of ours with a history of challenges in public health and how they access care. So we're really lucky to have smart people who know a lot more about this topic than I do to speak with us today. We'll put their bios into the chat box so you can dig into their history and expertise and find them on LinkedIn. Just a note that we are recording this session. We encourage you to be active in the chat and also to help us out with a very brief 3-question evaluation poll at the end of the session. We'll use some virtual out rooms for a brief interaction at the end. We'll probably spend about 10 minutes in those, just so you can get to know the people that are on the session with you and be a little more engaged in the topic. So for those who might not know, Catalyst is a network of funders, a community of folks. We have about 150 members who run the gamut from corporate funders to giving circles to private foundations, family foundations, community foundations. And about 5, going on 6 years ago now, some of our members were really smart in bringing to us the idea that impact investing was going to be a critically important part of this social change ecosystem. And so now we really think more about social change capital, social capital, resources that come from all avenues that are seeking to move a mission forward. And so when we think about having an impactful, equitable, collaborative ecosystem for social change in this region, it really does think about the role that everybody plays and every type of capital plays. So I'm very pleased to invite you into this conversation today. We really would love to see it be active and interactive. And to kick us off, our friend and sponsor from RBC, Brian Fairhurst, who is a great coffee partner, a fantastic leader in the field, and here to give some opening remarks, after which he'll hand it over to our moderator for the today, one of our national partners from Grantmakers in Health. Thanks, Brian.
Thank you, Megan, and welcome everybody. We're glad to have you here with us today for the second in the 2021 series of webinars in partnership with RBC in Philadelphia, California. I find the timing of today's discussion eerily auspicious. You know, with the Delta variant and renewed mass restrictions on even the vaccinated, they serve as stark reminders that the path out of this pandemic is likely to be at a glacial pace. And even more pointedly, economic recovery, especially for those most vulnerable individuals, business owners, communities, is likely to be much slower at more of a tectonic pace. So we're here today to talk about those public partnerships, public-private partnerships, and the seismic efforts that are going to be required by the philanthropic and impact investment community represented by all of you here with us today. And we're hyper-focused on these social determinants of health. And you know, as a firm, RBC is hyper-focused on scalable impact solutions. And I think the goal for the discussion today is to talk about the path forward to accelerate recovery for those vulnerable communities and seek ways to create enduring changes, systematic changes. So we're thrilled to have assembled the panel we have today of you know, deeply committed experts in this topic. And I'll hand it off to Dr. Kara James to moderate the discussion. We do have breakout sessions during this event, and we encourage participation with Q&A through the chat function during the conversation. So please raise your hand, make your comments, ask your questions. Let's make this as interactive as we can. Thank you for being here, and I'll hand it off to Dr. James.
Thank you so much, Brian. And thank you, Megan, for organizing this and inviting me to be part of it. I am Kara James. I'm the president and CEO of Grantmakers in Health, and I know that some of you are familiar with us as you are part of our funding partner community. But we are a philanthropy support organization working with more than 200 foundations and corporate giving programs across the country to achieve better health through all for better philanthropy. And as Megan and Brian have already talked about, I'm not going to reiterate a lot of what we have learned and seen over the past year, but really focus on what it takes to make sure that we're having an equitable recovery for everyone. Brian alluded to the fact that for our vulnerable communities, this pace is going to be a little bit slower. And I think it is important that we maintain a focus and continue to shed light on the issues and challenges so that as people begin to think about returning to normal or others, we don't forget those communities. I also think as we think about public health and the partnerships, we also need to focus on the data, because as we've seen throughout the pandemic, we've had data lags and data gaps where we didn't know what was happening in certain communities, and building that infrastructure to make sure that we have timely data on all populations and disaggregated data is really important. So and just lastly, as we're focusing on these social determinants of health, understanding that no one sector or no one entity can address these problems, and these public-private partnerships are critical to making sure that we do achieve equity in the future in all aspects of our life that have been illustrated in terms of the inequities that we've seen with the pandemic. So I am thrilled to be joined today and to be moderating the conversation by our speakers. And so I'm going to kick it off. And as Megan and Brian have said, we really do want this to be an interactive conversation. So please feel free to enter your comments and questions in the chat. And also for our speakers to make sure we're having an interactive dialogue. So with that, I'm going to get us started and turn to Melissa, who's with the California Healthcare Foundation, to kick us off and tell us a little bit about your organization and the philosophy that's guiding your work in health equity and what you see.
Absolutely. Thank you so much. Thank you for having me here today. It's an exciting opportunity to talk about our work and how we can all make the world better together. I am with the California Healthcare Foundation. We are a private philanthropy in California, and we focus on improving access to care and quality of care for Californians, and particularly those who are underserved, so low income and uninsured folks in what our Medicaid program, which is called Medi-Cal in California. We tackle that problem in a lot of different ways. Speaking to the foundation generally, we work with policymakers and regulators in Sacramento, where policy decisions are made. We work in the delivery system with plans and providers who are trying to deliver better care to Californians. 1/3 of folks in California are served by the Medi-Cal program here. So in that context, I run the Innovation Fund, which is our way of doing impact investing. We do that work because we believe that in healthcare, all of our challenges are super complex and super hard to tackle. And we think that there's no one way in. We have to pull all the levers we can pull. And we believe that there isn't any one group of people that can solve any of these problems alone. So my colleagues are making grants or publishing research, and I am looking to partner with emerging technology companies that I think have ways to solve the problems we're wrestling with, whether it's access to specialty care, whether it's integrating behavioral health care into primary care, whether it's how do we better serve homeless folks who are homeless in San Francisco. So I'm looking for companies that have a solution that can fit in that space, that my colleagues are also working against, and bring one more tool to the tool to sort of try to move the ball forward. The question is, why do I think Medicaid or Medi-Cal is primed for impact investing? And I have to say, I don't necessarily believe that. I think, healthcare is hugely hard, it's hugely regulated and hugely fragmented. And so my policy colleagues and I go back and forth about whether you could go to the delivery system or whether you go to policy and regulation. I think you do both. I think it's systems change and you have to go back and forth. However, I think that is a huge market. It's 1 in 3 people in California. And I think that we in the safety net need technology-enabled services. That's sort of the air we breathe now in healthcare is technology and technology platforms and that way of working with each other. And we can't let the safety net fall behind in that because we'll just become more unequal in how we deliver care in California. So yes, it's an opportunity that's primed, but it's also a moral obligation for all of us to do this work. I'll just give you a couple examples of how we tackle these kinds of problems. So Dr. James mentioned data, which we all were aware of, even more, that is even more important and more broken as a system when we went through the COVID pandemic, which we actually are still going through. We partnered and invested in a company called Collective Medical Technologies. And when we invest, we generally make a sort of a low income loan or an equity investment to the company. And then we surround that with grant support that we give to plans and providers to sort of help them engage with that solution. And Collective is a way of sharing data, ADT feeds, if anyone knows what that is, that between all the care providers in a geography. So if you have someone, we did this in the context of the opioid epidemic, if you have people that are moving around the community and you don't know where they are, or they're hitting up multiple places at once, and you're trying to do care coordination better as a population, Collective was a way to share first ADT information, but then CCD information about people. So people who are trying to help them could know where they were and how to help everybody engage and get them to the right places in the delivery system of care. So that was one of the kinds of partnerships that we made to do our work better. I'll stop there. And
thank you. That is really helpful. And I had to chuckle, as you said, Medicaid may not be set up well for impact investment, but I do think there are some opportunities. And maybe before I turn to Liz, just to kind of delve into that a little bit, because I don't want people to leave with that message of don't do it. Where might you see that there is real opportunity in Medi-Cal to do impact investing?
Yeah, and I don't mean it about Medi-Cal specifically. I think healthcare is hard, and entrepreneurs and investors who are working in healthcare need to have their eyes wide open because it's just different than consumer goods. It's just different. I think, so when I look at where the opportunities are, I sort of follow the regulatory changes. And if you follow healthcare regulation, we're much more focused on value-based payment. We're focused on integrated care. We're focused on bringing the social determinants of health and social services and community-based organizations together with the clinical system to be able to tackle whole people. And so I see a lot of opportunity in not just data exchange across those sectors and across those players, care coordination, even basic things like, God, we have to understand each other. Those are two different worlds. And so anytime I see a big regulatory change, I think about opportunities where we can provide investments and bring entrepreneurs to tackle those challenges in the context of those changes, because that's when people are really focused, and that's when you can shake up existing systems. So integrated care, behavioral health, social services, technology-based referrals, all that, I think is a really good opportunity for entrepreneurs and investors to think about where they can make a difference.
Thank you. And yes, I completely agree with that. And we'll delve into that a little bit more because there are some changes. And I think what is some of those opportunities that are happening at the federal and state level that can have an impact on this is particularly in the space of equity, as we're seeing the federal government much more attuned to that and thinking about that. Oh, sorry, go ahead.
I was just going to say, you mentioned equity. One more example. I think, disparities in health outcomes across racial and ethnic lines have always been true. Obviously, recently, everybody's more aware of that, not just people that have been living that forever. One example is a company called Docent, which is focused on maternal health outcomes. And so it's a sort of a care navigation platform. Actually, Pablo knows this well because its core customer is Dignity and Common Spirit as a health system. And it's really focused on helping birthing people, particularly women of color, Black moms starting in LA, to navigate that delivery system in a way that's more coordinated. And it really is targeted at improving Black birth outcomes, which are just horrific relative to sort of baseline. Sorry to interrupt, just wanted to throw that one out.
No, it's a conversation, so no, feel free. So Liz, let's talk a little bit about some of the work that you do. And, as Melissa was mentioning, a lot of these organizations are really mission driven. And so what do you see for these mission driven partners and what they need and how does this guide the work that you're doing on health equity?
Yes, thank you, Kara. And I was going to say, my team and many of my fellow investors have learned so much and often come to call on Melissa and her team at the California Healthcare Foundation when we're dealing with a situation in Medi-Cal around an area of innovation. And I think that's a place where it's just a classic example of partnership, and the partnership that's really required for different parties coming together to leverage each other's awareness. That often she's, Melissa is the voice of reality of like, okay, let's be realistic of what is going to like happen and on, sort of who needs to be involved. But also so often creating that kind of constructive insight that helps a motivated entrepreneurial team to see a through line that they can follow. So I think that's the grounding is important and part of doing this work. And I might just give a little bit of context because I probably come from a slightly different platform than some of the other folks gathered today. So I am with Kaiser Permanente Ventures. We are a strategic venture fund, strategic in that our mandate comes from Kaiser Permanente in terms of what we invest in. And so in that way, we do have a clearly defined mission statement to be investing in innovation that is going to forward the world of US health and healthcare in the spirit of the Kaiser Permanente mission. So we get that privilege and opportunity to invest in companies that are really pushing that forward. That said, it is a traditional-ish venture capital structure. So we are looking to buy equity in companies, to take active roles in their growth and development on the board, and to make a financial return that is commensurate with what you would expect for a venture fund. We just do that through that mission lens, sort of what are the companies that we feel are upholding that Kaiser Permanente mission. So with that said, I think the interesting part of this work, and I've chatted with a few of you around the table about this in the past, but this last year has entrepreneurs that we've invested in who are doing amazing work in mental health. I think of folks like Big Health or Ginger, where they are trying to create broad access to either talk therapy, coaching, cognitive behavioral therapy tools, and seeing the pandemic's effect, not just on those who are in an employed population that might traditionally have access to their services and are starting to think about, hey, I got into this business because I wanted to create really radically broader access to mental health care. And I am being reminded in pandemic times of the limitations that kind of a commercial model has put on me. And so I think, where I get excited, my background in this is I came to the Kaiser Permanente Ventures Fund from a group called Imprint Capital, where we were working with partners like Robert Wood Johnson Foundation and Acumen and Packard and a number of other fantastic folks to try to bring them into the world of impact investing. And so when I see entrepreneurs start to have this question and kind of go back to that mission root that brought them into what they're doing, I get really excited because I know all of you exist. And I know there's all these other places that an entrepreneurial engine could get paired with a really powerful funder who wants to try to pull some innovation into a different market or population. But just a couple of other, the sorts of things that we invest in beyond mental health. We've invested in Omada. That's another co-investment that we've learned a lot alongside the California Healthcare Foundation. Omada originally focused on the diabetes prevention program, helping folks who are in a pre-diabetic level of their glucose levels to not progress to full diabetes. And that the process of doing that is the super hard work of behavior change. How do we get people to sort of feel supported to make certain changes to help them to lose weight and not progress to diabetes? So that company, we've been on almost a 10-year journey now as they've really expanded quite dramatically and have tried to learn how to move into Medicaid through that work as well. We do work in addiction care through a company called Groups. And I say we, again, I just invest and get to learn alongside these teams. But Groups Recover Together is an opioid addiction clinic this is an exciting one for us in terms of folks who are thinking about innovative care models that might leverage technology or just different structures to really create access to addiction care for the Medicaid population in particular at a price point that is achievable for folks who are covering those populations. But also, to me, the most exciting part of that group is their focus on outcomes. So the addiction world is a place where sometimes we don't have a lot of data of what works. And they are using a lot of their structure to drive that change in the industry and help payers and other groups demand data, we want to know what the outcomes of these services are. So really excited about them. And then we go, Kaiser Permanente is a big, broad organization, so we get to invest quite broadly. One of our more recent investments is in a company called Everytable. It's a public benefit corporation focused on creating broad access to fresh, healthy meals. So prepared meals that are easy for folks to work into their lives, but still get fresh and healthy food rather than frozen or packaged food. They seek to serve that both in communities that are underserved by fresh food, but also at a fast food price point. So that's really the whole corporate structure there is focused on how do you create all of the things that need to be true to have fresh, healthy food be available, competitive with Jack in the Box or McDonald's or other places that folks might kind of instinctively turn to. And those folks are doing that hard work and also really focused on thinking about how to help value accrue to the communities that they are feeding. So they have set up a social equity franchise program that is explicitly looking to and partnering with folks within the community who want to become franchise owners, in addition, maybe beyond becoming just a store manager or something like that. And so there are a number of capital partnerships that we can talk about that they are setting up to make low-cost capital available to those who would like to pursue franchise ownership. And it's just a great, really exciting example of where the company, the board, the investors are all seeking to make sure that we are not just focused on shareholder returns. We're focused on creating value for the community in a very explicit way. So those are a few examples. Happy to get into more, but really glad to be with everybody today.
Thank you. And we will come back to those partnerships. I want to turn for a moment to Pablo and bring you into the conversation and ask you to share a little bit about the work that you do in your organization, and maybe tell us a little bit about what is a big target for you right now that you're thinking about, and what's the philosophy that guides your work in health equity.
Thank you, Kara, and it's really a pleasure to be here and to share and learn from all these great folks. And I already see the tie-in between Melissa's work and Liz's work at our partner in Kaiser. I'm Pablo Bravo. I'm the System Vice President for Community Health at Common Spirit. Common Spirit, we're in 21 states and over 140 communities. And my work is really, our work is towards addressing the social and economic and environmental conditions that influence health in our communities. And really through grants and investing, we try to address those issues and really create great partnerships as well. As a healthcare organizations, we have hospitals in most of our communities. These hospitals are anchor institutions, what we consider anchor institutions. And in some places, we're the largest employer, significant purchaser of goods and services. But also, we try to invest our capital in these communities to be able to address some of these inequities that impact our patients and our families. One of the tools that we have in community health is a community investment program. Some folks might call it a mission-related investment or program-related investment. We call it a community investment program, where we make low-interest loans to nonprofit organizations to either build, construct housing or expand clinics, or even support the small businesses. We focus on different levels, or we call sectors. Housing is one of them. Environment is definitely an impact that we see across all our communities, health, food, and access to capital, arts and education, and other areas as well. One of the things that we noticed, and I don't think it's anything new that we hadn't noticed before, has been the impact during COVID on food insecurities and housing insecurities. Those have been the two most focused areas that we have tried to address in these past, 17 months going into the second year. And it's not going to go away anytime soon, as we saw in the newspaper. Even though the rental moratoriums have increased, we still have a lot of insecurities that are going to happen. So we use our capital to be able to address some of these things. And in the area of food, we focus on food from all different spectrum, from the production to distribution to the wholesale. One of the projects that Liz mentioned, every table, we're also an investor, and we think that that is a great way to address food insecurities, the whole food desert issue, as well as to fight off. We also make investments and try to fight off predatory lending. And so I'm going to say predatory food distribution. So it's a check in the box, and nothing to say bad about anybody, but just get real. Definitely every table. On the food production, we made an investment to California Farm Link, which provides capital to minority-owned farmers for them to be able to get equipment, purchase seed, even help them maintain their land, where otherwise they would have to sell off to major corporations and otherwise, leave land that they've owned for a long period of time. With the housing sector, we look at the whole spectrum of housing. We look at respite care, recuperative care as a piece of housing, scattered housing, supported housing, good, sustainable, quality rental housing, and even home ownership. Home ownership, we feel, is a great way to address inequities by having families really own their property and build assets. It has a major impact on not only in the mental health of the family, but also on how people move into the future. So we use this tool as much as we can during COVID, even more so around scattered housing, and also we use our grants to support and address these housing insecurities around rental payments, et cetera.
Thank you. And one of the things, we have about a little more than 10 minutes left before we go to the breakout session. So again, just going to encourage everyone to enter your questions into the chat box, or submit those, and we'll work our way into those. And while we're doing that, one of the things I just kind of wanted to back up a little bit, because Pablo, you talked about, communities of color and some of the work that you're doing. And what we have seen, or I'll speak for myself, what I have seen a lot in this past year is a lot of people who have become more aware of the inequities that we have, are talking about health equity, but we're not all using the same language, and we're not all talking about the same thing. So I wanted to just, talk a little bit about sort of what we mean by health equity, and then to ask sort of each of you in the context of the work that you're doing. We've heard a lot about, racial equity and communities of color in particular, and a lot of the examples that you guys shared talk sort of in generally. And I think there's a perception among some that by just addressing the social determinants of health, we will also achieve some of the racial equity that we're looking for. And I think there's some evidence that we have from our National Healthcare Quality Report and National Healthcare Disparities Report that simply focusing on quality alone doesn't reduce those disparities. So maybe to kind of push a little bit to think about, where are those opportunities, and to what, how is race, if at all, playing into the work that you're doing, particularly in a state that is so diverse and has inequitable distribution of these factors in terms of home ownership, poverty, and other things like that. So I will sort of ask that question and think about, when you are talking about equity, what does that mean for you and your organization? And I saw Melissa come off mute first, or I don't know, Pablo, you're already off mute if you have an answer.
I let Melissa go first.
No, go Pablo, go.
So, hopefully I won't get in trouble. I usually do. Hopefully we're looking at health equity seriously. We tag on to these words like the social determinants of health, and that seemed to go on forever. And now we're moving into health equity and equity. Hopefully we're taking these things seriously as we say them. I know our organization takes them very seriously. From a healthcare provider, healthcare equity means several different things. So from my perspective, health equity means if you come into one of our facilities or you come in to see one of our doctors, you are going to receive the same healthcare as anybody else, no matter who you are or where you come from or what demographic you fit in. It's equal healthcare among all. From a community health perspective, we can call it health equity, but I call it equity because the main thing here is to make sure that individuals have the equal right for education, good job, good housing, clean water, clean air to breathe, etc. So, and that all impacts your health. Any way you look at it. The way we address those things is by taking a look at what kind of resources can we put in our communities to be able to address these issues. In equity, and when you talk about individuals, demographics, whether you're Black, white, Latino, Asian, a lot of these communities that we are addressing equity are poor communities. And poverty does not discriminate across the board. Unfortunately, deeper poverty exists on different demographics. And so in an effort to address some of these equities, we need to focus a little bit more on how we use the resources to go deeper into addressing the disparity of poverty among the different demographics.
I could just say a little bit about what we're thinking at CHCF, and just my perspective. We historically have focused on equity in terms of equal access and equal outcomes in terms of language, race, and income. And we've done it through thinking about the Medi-Cal program, which is, disproportionately people of color. I think what's happened to us recently is that we're understanding that that's not enough, and that we started tackling this we have a maternity initiative body of work and focusing on disparities in Black birth outcomes, that we need to get way more able and skilled at talking about systemic racism and implicit bias as it exists today in the healthcare delivery system. So we're trying to not just sort of have that be like in the world, but actually have that be just an explicit thing that we all understand, that we have any skills to work on as a healthcare foundation that really doesn't have good expertise on racism in general. But we're just trying to figure that out and figure out how we can make a difference in that space, including by diversifying our own staff, including by getting smart, including by building our networks to be much more expansive. So that's one thing that I think is different about how we're thinking now. Secondly, in terms of the impact investing work, we just did a retrospective. We've been around 10 years and looked at whether we actually accomplished any things that we hoped to accomplish with this tool. And we think we did a really good job on sort of outcomes at scale. And when we look at the leadership in our portfolio companies, they are reflective of the racial profile and gender profile of venture capital in general, which is predominantly white men. And so we're trying to think about how to really reach and support entrepreneurs of color who are traditionally underrepresented, particularly at the later stages of company development. So we're expanding our efforts, investing earlier, and trying to build networks, because we believe lived experience is the only way really to create solutions and reach communities that we're trying to serve. Like, as a white woman, I just am disadvantaged in trying to do that. So we're trying to find partners that have more authority to solve those problems.
Amazing. And I'll chime in briefly. I was going to say, Pablo and Melissa, you have such more tangible focus on health equity than the world of venture capital often gives itself a pass in terms of thinking about some of these things. So I appreciate the question, and also want to own sort of the state of things on my side of the fence. I do know within my broader organization, there is both an incredible legacy and huge focus right now on health equity, as I'm sure many folks are aware of, and a little bit of this concept of making the right thing easy to do, right? And that's not just about what our clinicians do. That is also when we think about community health, when we think about supporting social justice, when we think about dismantling racism, these big things that the broader Kaiser Permanente organization has been seeking to take on, that's often kind of the guiding light of sort of how do you make that right thing easy to do. Within the world of venture capital, what we have heard is a little bit what Melissa was just in a very self-reflective way reflecting on of wire and hire. That is what we have heard very, very clearly. So the opportunity to mentor folks and give folks from communities that may not typically have access to all of the wealth and influence that a venture capital backed business can create. The most meaningful things are wiring funds, meaning sending venture capital to businesses that are led by and owned by people from underrepresented backgrounds, which, as Melissa said, still pretty much everybody other than white men. And I would say white men between the ages of 28 and 42. We're real narrow in kind of what we do well. So there's a lot of room there. And then hiring in terms of who we bring into our own fund, who we bring into our company leadership, who we bring into our boards as independent board members. So this has been a big area of focus for our fund. I know there are some other funds who are also taking the moment to really push. It's hard. It is uphill. And the one thing I would call out, Dr. Ivor Horn did a great report with the Rock Health organization, just looking at kind of what is the nature of this reality? Because it's certainly not that other communities outside of our archetype of who gets venture funding are not entrepreneurial. That's not true. And it's not true that no businesses are getting created, but they're not getting venture backed sort of paths. So what is that about? And she did just, I think, some really brilliant work in trying to unpack that and help us all understand how the reality that we have gets there and what are the points where there is real utility in intervening.
Thank you. It is a tough issue. And I see that Megan added sort of her approach in thinking about what health equity is. And I'll just share with everyone the sort of Robert Wood Johnson one that kind of is really helpful in sort of sharing some of the difference between equity and equality. And it is hard. And I would say that honestly, I'd love to have a conversation with you guys for like another hour just on this, because I think for those of us who've been doing health equity for a long time, and I was talking to somebody about how long I've been doing that, and I won't say that because the gray is showing, but we also need to get more savvy and as I say, multilingual in how we are talking to and making the case for venture capital and others about equity so that we get some of that investment. Because Liz, one of the things that we think about is some of that is proximity. So the people and that's who you fund, and that's everybody kind of does that. So how do you lift those voices up? Well, in the last minute that we have here for this, I'll do kind of a rapid fire before we go into the breakout sessions and just say, As you think about where we are, both about ongoing process of reopening California and investments in the long-term health of Californians, because this is going to be a long-term recovery, what is your vision for the future of impact investing in health equity?
I think for us is really looking at investing in areas that are going to make communities resilient and sustainable, because over time we have keep seeing communities get impacted by the economic crisis, now the pandemic or the real estate crisis over and over and over again. And it seems like these communities are lacking the resiliencies to be able to pull out of it.
I think one of our priorities, if not our priority, is developing leaders or supporting leaders that are the next generation of investors and entrepreneurs who are diverse, who are people of color, who are women, because I think those are the authentic voices that have most ability to make change, and we're missing that. And so we want to do anything we can to create that army.
Amazing. And I'll just say, from my perspective, this is a moment, the pandemic, if it has a silver lining, one of them is the entrepreneurial energy that I see coming from a lot of different corners. And I think it is a moment where it's my genuine hope that a lot of funders, whether from my sort of venture capital side of the aisle or folks who have more access to grant or other style of capital, follow that entrepreneurial energy, right? As funders, sometimes we can be a little bit slow and set in our ways and sort of how we do what we do. But seeing what these entrepreneurs need, because they do need that, I see it in the world of venture capital. If somebody wants to do something that's very mission oriented, they need a funder to get in the capital structure to create that spine, that sort of like, we are here because of this mission. And so a lot can happen when you have a great partnership between entrepreneur and funder. And so I think that is the chapter that for our work in health and healthcare, I really hope to see more innovation and pushing forward on what's possible, and to really nurture this entrepreneurial energy that we're seeing right now.
Thank you, Liz, Melissa, and Pablo. Thank you so much for your comments and your time. This is really a conversation we could have had for a long time. And I think, to your point, Liz, we are in a moment. And as each of you have talked about, these are long-term solutions that we need to work on. And while the moment may pass, I am hoping and hopeful that the attention will sustain as we do the work that we need to build that equitable recovery in all aspects of our society for everyone. So with that, I'm going to turn it back over to Megan, and who'll give us instructions on what we're doing next.
Thank you so much. Thank you, everyone. Whew, I agree. We could just keep on going and continue to learn from you all. But what we want to do now is transition to some smaller groups so that we can learn from one another. And I think what we just heard here is this idea of everybody has a place, right? Like venture capital can do certain things. Foundations can do other things. Government needs to come in and do its thing, because what we really want is to create change at home in our own organizations and communities, but then to strengthen and scale that to a systemic level. And so we all have to find our place in that process. And I also want to mention, because I forgot to, mea culpa at the top, that part of the way that we scale impact is through our partnership with Philanthropy California. So my friends and colleagues at Northern California Grantmakers and Southern California Grantmakers are also a part of putting this all together. And collectively, we're about 600 philanthropic and impact investing members across the state. So thanks to them. And with that, I think my colleague is going to send you all to small groups for about 8 to 10 minutes. We'll come back, invite a couple of folks to share out what they heard, learned, or were challenged by, and then we'll send you off to lunch. All right, have fun. All right, welcome back. let's see just who we have with us. Welcome back, everyone. Any insights or things to share? I ended up in an RBC party. It was me and 3 RBC folks, which was super fun.
I think one of the things that came up in our conversation was like the difficulty of impact investors and philanthropic funders to respond to COVID, because like it's such a crisis, and it's an immediate crisis. And many of us, because we're in healthcare, are thinking about systems change. And so like we're not wired to do like quick emergency funding on things, but yet the need is screaming. And so how do you do that well, or how do you figure out how to partner to do that well? So it continues to be challenging to figure out the right way of being in the world, given the nature of the challenge.
Yeah, Melissa, you're so right. I hear that in almost every room I'm in now. Is we'll get to the okay, so we've sort of are at least in a managing stage of COVID. So how do we look at the long term? But also the house is burning. We have serious racial injustices happening. We have people dying. So we can't just go back into this sort of privileged position of, okay, let's just navel gaze a little bit right now.
I know. Yeah. And we don't have enough providers that reflect the communities they serve. And it takes 20 years and more money than anyone has to grow one, because you have to go back to the university structure. So that too, workforce is a hard one on top of it all. So
yeah. Well, I just appreciate that everyone's thinking about it and showing up and having those hard conversations, and would encourage you to reach out to us. Your NCG and SCG and Catalyst, we are here to help convene these conversations and make connections, and hold some of that innovation. So with that, I want to say thank you. I think probably as soon as I stop talking, a literal 3-question survey will pop up. And there it is. So please fill that out to help us. We appreciate all that you do and wish everyone good health and successful investments. I want to offer a particular thanks to Dr. Kara James for moderating today and bringing the insight of grant makers in health to this conversation, and the rest of our really great panelists for sharing their insight. We will see you for the next one, and have a really lovely, healthful day.